of quality teaching and learning, to the EdTech Lounge, which is a virtual community where our faculty members who have tried out new strategies during the past few months are able to share their experiences and have a discussion. So our today's speaker is Dr. Faisal Ismail. He is an associate professor and consultant gastroenterologist and the director of endoscopy at the Aga Khan University Hospital. He's also the vice chair of education in the Department of Medicine and the chair of Year 5 Undergraduate Medical Education Committee. Dr. Faisal Ismail is also a senior fellow of the Higher Education Academy UK and a certified healthcare simulation educator. So Dr. Faisal will share his experiences and thoughts for 15-20 minutes, and after that we will open the session for question and answers. During the talk, if you have any questions or comments, please use the chat window and also introduce yourself in the chat window. Thank you very much, and over to you, Dr. Faisal.
Thank you, Azra. Thank you very much. Without further ado, I'll start to share my screen. Right. Am I coming on all right?
Yes.
All right. So once again, I'm feeling really terrible to keep everybody waiting, and I sincerely apologize. I wish this was in my hand, but I'll try to make sure that the next 15-20 minutes are a little interesting for all of you, so it's not a total loss. As we're talking about interprofessional education, the time is now. And honestly, I think all of us do feel that the time has been there for some time, but I think it's important that we start having a very serious conversation about that at the Aga Khan University. And just to put this statement out there, improving healthcare outcomes is the reason we are all here. And that is true whichever entity we belong to, whether it's the medical college, whether it is Sonam, wherever it is, whether it's in clinical practice, we are here because we hope to improve healthcare outcomes wherever we work for our patients. Given that, it was an extremely important report and an eye-opener for the medical community when the Institute of Medicine about 20 years ago gave a report called To Err is Human, Building a Safer Healthcare System. And this actually described an incidence of 44 to 98,000 deaths annually. But then a 2004 report actually stated that actually may be an underestimation of the report of the deaths that are happening due to medical error or medical negligence. And a very recent study by William James et al. Estimated that there may be an incidence of around 210 to 400,000 deaths a year just due to medical error. And although these numbers are terrible to think of, the fact of the matter is that all of us know that even if it's a single incident of either morbidity and, God forbid, a mortality due to medical error, that is still too much. Even one is too much. So why do these errors happen? Well, it's because modern healthcare has now become very complex. It's become multifaceted and it's often fragmented. Patients see many different health professionals all over in the course of a single illness. When I speak to my parents, and if you think back, maybe 40 years ago, medical healthcare was not what it is right now. There used to be one doctor, there used to be one surgeon, there used to be a family doctor for everything, and you went to that family doctor regardless of whether you had a cough or a cold or you had appendicitis. And that person, the whole family went to that doctor, and everything was taken care of by that one doctor. You hardly ever went to a hospital because the clinic or the surgery, the doctor's own personal surgery, was the place to go. But as specialization has happened, as we moved on, as healthcare has become more complex, unfortunately, it's also become more fragmented, and patients now see different healthcare professionals over the course of a single illness. And we've seen the enormous number of consults that are raised. The extent to which their care is coordinated and these health professionals communicate effectively and as a team influence the outcome of the patient. And teamwork and communication between health professionals have a very important effect on patient outcomes. And how do we know that? Tons of data to show that this happens. Evidence for relationship between teamwork behavior and clinical patient outcomes. And even when you adjust for cardiac arrests, nosocomial infections, even if you adjust for all of that, the fact is that there is a very strong link between teamwork behavior and clinical patient. And this was very interesting to me because miscommunication is the root cause of nearly 90% of sentinel events, as per the JCIA report in 2011. And this is something I think all of us have known intuitively for a very long time, that miscommunication and wrong communication can help a lot of matters, but unfortunately they don't, because we don't address them that same way. Right, so what can we do about that? Well, team training could be one thing, and team training has been used in other professions for decades. The military has been using team training for specific tasks for a long length of time. But in speaking to other professions, you'll find out that people in marketing have been using it, people in banking have been using it. It's been well recognized that team training allows tasks to be done more professionally, more proficiently, and without complication. Yet paradoxically, it's used very little or very late in healthcare. Although we are the people who need to use it the most, because we are interacting with individuals from diverse backgrounds, different levels of expertise, different levels of experience, different communication skills, all of them involved in patient care, all of them taking the same care of same patient, whether it's the physiotherapist, whether it's the phlebotomist, whether it's the nurse, whether it's the physician. And all of us functioning in an environment which is prone to error, which is characterized by high stress outcomes, yet we have not taken on team training as we should have. And I like this quote very much, which says that we can say that the physician or the nurse that looks after us is an expert. But can we honestly say that the team of professionals who look after us are experts? And the answer to that is probably not. So what is a team? Let's define that. And a team is defined as a group of individuals, each with specific roles, all working together to accomplish a common goal. And they must interact and adapt to achieve specified, shared, and valued objectives. That is the characteristic of a team. Let's get a few definitions clear, because this is something that I was also not sure of, but once I came to know this, I know that a lot of these terms are used interchangeably. However, they shouldn't. So what is interprofessional education? And that is when students from two or more professions learn about, from, and with each other to enable effective collaboration and improve health. And this is very important. The words about, learn from each other, learn about each other, and with each other is what constitutes interprofessional education. Formal interprofessional education aims to promote collaboration and enhance quality of care. Now, you may have interprofessional learning that can happen anytime, but that's an informal learning. That's like me on the round telling a nurse intern how to put in a cannula. But that's not when we are learning from, about, and with each other. So if you talk of interprofessional education, it's a group activity comprising two or more professionals who meet these characteristics. What is intraprofessional? An intraprofessional is involving activity between or among individuals, but with the same profession. So for example, a surgeon or an emergency physician, a resident and a physician, etc. There are two more terms. There's multidisciplinary, and this happens in professions with different perspectives are brought together for a wider understanding of a particular problem. And multidisciplinary is usually something that we use for groups. So for example, you may have a multidisciplinary tumor board. You may have a multidisciplinary team looking after a few patients. But is that education? No, because you're not learning with, from, and about each other. And finally, there's multi-profession education, where members of two or more professions learn alongside each other. In other words, they are parallel rather than interactive learning. So you may be learning advanced cardiac life support workshop with people from the profession of banking, people from the profession of marketing, and maybe physicians as well. This would be multi-profession education. It's not interprofessional education. So with that out of the way, what are the competencies of an effective team? And these have been defined extensively in literature, but this is what characterizes an effective team. There's team leadership. So there is a clear leader who the team looks up to for direction and vision. There is mutual performance monitoring, where the team members not only look after their own selves, but they also look after the performance of the others and provide backup behavior, which means looking after them if they slack or if they seem to be in trouble. There's a team orientation, which means that the team will move away from personal goals and work towards the benefit of the patient and towards the benefit of the team. And that is called team orientation. And adaptability, which would mean that based on the scenario of their environment or of the patient, they will adapt their working. These 5 characteristics or competencies are bound together by shared mental models, which is a shared vision of what you want the team to be, mutual trust, and closed loop communication. And you'll realize from all of this that this is extremely difficult to do. When you have disjointed people having different working hours who don't even know each other to come together, it's not possible for them to work together simply because these competencies can never be achieved if they don't work together, have not practiced together. I want to introduce you to something which you already may know of, but nevertheless is extremely important, the Interprofessional Education Collaborative, which is a group brought about in the US once it was realized through many reports that team training needed to be introduced in the healthcare over there simply because of excessive medical errors happening because of lack thereof. And the IPEC evidence-based team training objectives point to 4 major objectives that have to be part of every team training schedule that you make. So these are objectives that if we as educators sit down and think of devising for a team strategy for team training, we've got to look at these and make sure that our scenarios and our assessment aligns to these goals. And these are values and ethics for interprofessional practice, where they talk about a patient-centered professional identity. It's about roles and responsibilities, which means identifying the leader and everybody in the team having their own professional roles. Interprofessional communication, and when we speak of closed loop communication and mutual trust, that's actually variants of good communication, right? So interprofessional communication, effective and constructive communication, and teams and teamwork. Teams and teamwork doesn't come naturally to people. It needs to be built, it needs to be practiced, and we need to practice behavior and integrate the knowledge of other professions. If you may have noticed, I've put in a small asterisk above objective, and that's because I wanted to talk about 2 very important things. And that's that when the IPEC talks about team training, it talks about the patient being a very important team member. The patient is a member of our team. In other words, the plan is not going to work if you don't have the patient on our side. And honestly, this is something that we have lacked as a healthcare team, where we do not involve the patient in the relationship. So the doctor comes, he speaks to the residents, it's all jargon. They tell the nurse what to do. Again, they tell the nurse what to do instead of involving the nurse in care. And the patient is just lying there, and it really depending on the doctor to maybe tell him something, or he may even not. The other thing is, and this comes in the roles and responsibility over here, is that the team leader is not always a physician. And this is a cultural change that we need to bring about. The team leader can easily be a nurse. It can easily be anybody else who is suited for that particular team training that we're doing. So this is very important, that the leader is identified based upon the scenario that you're doing and the task that you're doing. So let's say if I've been able to interest you in making an IPE session, how would you move on? And this is a small roadmap, and this is an extremely brief roadmap, and of course each component has a multitude of factors to look at. But in essence, this is what is really done. You need to do a needs analysis. So I've put in an example over here, which would state that, let's say I want to make a interprofessional education module for nurses and physicians, for example, addressing teamwork. That I feel that the importance of teamwork and communication is not a critical skill that is adequately emphasized, and therefore I want to be sure that the philosophy in medical and nursing schools to teach and develop a culture around the importance, and I want to do that. That would be my needs analysis. What would be the instructional methodologies I may use? Many. I could use a tutorial where I could explain to candidates, to participants what medical ethics is. I could have a small group problem-solving session. Beautiful ways to build up team training is role-playing and simulations. And honestly, medical healthcare simulation has taken team training by storm. It is, I feel, the future of team training. I think medical simulation and role-playing is the essence of team training. And I think if any of us want to make an IPE session, we'll have to be really have a lot of simulation in there to make it really effective. Review of video vignettes and a standard debriefing and feedback process. But after you've done that, you've got to make sure that you can implement it, right? And how do you implement your instruction methodology? As an example, I've put in maybe 2 half-day workshops for all nursing students and 30 medical students with intra-professional facilitators. This is very important. You can't have people facilitating these sessions if the facilitator doesn't know best practices about IPE. And that's a whole completely different conversation we need to have about faculty development, team building, and development of faculty to do all of this. And I hope that the Teachers Academy will really be helping us do that to build capacity. Finally, after you've implemented your teaching and educational activity, you would want to make sure that what you've done actually makes impact, right? So you'd want to assess and you would want to evaluate, and you can do that in multiple. You can do a pre-post. There are multiple team assessment tools that you can use. There's a Mayo team sharing score. There's a Harvard score. There are tons. But this would be sort of a roadmap for you if you want to develop something for IPE. Then this would be the 4 factors you would look at: a needs analysis, get your instructional methodologies down, think of a way how best to implement it, and then evaluate what you've done. Just a few pearls about team training. It's just not that you get people in and you get them all together and you do a team training. You need to remember the 4 critical teamwork objectives, and I'll just revise them with you again. The IPEC competencies, which are values and ethics for interprofessional practice, roles and responsibilities, effective communication, and teamwork. You have to emphasize teamwork over task work. A lot of the times, and literature bears me out here, that people come to team meetings and then they practice tasks. So for example, if the team training is taking care of a patient with an upper GI bleed and I have to put in an NG tube, a lot of time is wasted in how to put the NG tube in properly. That's not the objective. The objective here is team training. So it's got to be teamwork over task work. Please remember, and I'm sure you know this, one size doesn't fit all. And your team-based learning outcomes will guide the process. Because effective team training is an educational science. And it's all about knowledge, skills, and attitudes, right? That's what you need to change. And that's where team training will work. It's not the task, it's the team behavior. And for that, you may need to use a mix of methods of instruction practices. For example, like I said a little while ago, a bit of tutorials, a bit of pre-reading, a bit of role play, a bit of simulation. Also, task exposure is not enough. Hands-on practice, extremely important to do as a team together to make sure that you're gelling together and everybody knows what their work is. Ensure that the training reflects work environment. So it's extremely important to maintain fidelity and to avoid stereotyping of a particular role. It's extremely important that the physician remains a physician. The nurse plays the role of a nurse. Don't tell the nurse to play a role of a physician, because that's completely out of context. It doesn't apply to what she regularly does, and therefore there is going to be no retention. So keep things in context. Make sure training reflects work environment. Feedback matters. It needs to be descriptive, timely, and relevant. And giving feedback is a whole science, and that is something beyond the scope of this talk, but all of us know how important what the methods of feedback are. We have to go beyond reaction data. In other words, it's not enough for your participants to come out and say, it was great, really enjoyed it, and I hope to come to other meetings. That's not enough. We have to evaluate clinical outcomes. Did it really make a difference? Training has to be validated to measure learning outcomes and to determine program effectiveness. And finally, reinforce the desired teamwork behaviors, what people have learned, which means that once they go back on the job, there has to be a way where the teamwork behavior that they've learned is not only reinforced, but it's also evaluated to make sure that skills are not decaying. So to conclude, and so that we have a little time to talk, it is clear that training and practicing in silos, which unfortunately we have been doing, is a threat to patient care and safety. We understand that healthcare is now delivered in teams and is therefore logical that we need to train our healthcare providers, all of them, as a team, and not just in undergraduate education, but also as practicing providers. Beg your pardon. Team training using simulation will afford the opportunity for practitioners from different disciplines to come together to improve the skills which they use in the clinical settings, and that would probably be the most realistic way to do it. Team training cannot be taught sitting in a classroom and telling people to work together and gel together. They have to work together to really make it more realistic and for it to have impact. There will be a need for curriculum standardization if we go down this route. Deliberate skills practice, keep practicing until it becomes second nature and we become better, and an outcome-based evaluation. Training without these components leaves competency largely up to chance. And given the high-risk nature of the work we do, it's just not enough that competency can be left to chance, and we leave it at just chance that whether the group of people who look after us know their job or don't. It's just not be accepted. And because of the growing and sustained focus on medical error reduction, there is a very important need for all of us to move to a model that incorporates interprofessional education in under as well as postgraduate curricula. Thank you very much for your attention, and I hope I've been able to keep your interest for some time, and I'm happy to discuss anything that you would wish to.